Dr. Raywat Deonandan. He's an epidemiologist at the University of Ottawa. And Raywat, this is our premier musing about a curfew.
A curfew that would be designed to restrict travel between key hours when gathering sizes tend to be dangerously in excess of the rules. Late night hours, obviously.
No decisions yet. Consultation for the next few days. Where are there curfews right now, and do they work?
Well, right now, Spain is starting a curfew, and they've got some demonstrations as people aren't pleased with it. Germany, Berlin, is starting their first curfew in 70 years. And Australia had a successful curfew as part of their successful elimination strategy recently. Do they work? That is a big question. It really comes down to the culture of where they're applied and what the problem is. Because what we're trying to do, of course, is to remove the incentives or the opportunities for people to interact with each other in an undisciplined fashion. And if the problem is people, after hours, getting together in public places, if you take that off the table, then, that won't happen. But if people are getting together in house parties, the curfew may not affect that. So it comes down to what the base situation is on the ground where you live as to whether or not this will work.
And I wonder whether or not we see what's going on in the United States, and clearly outbreaks there beyond what we have here in Canada. And people think, well, we're not that bad. And as a result, we can behave this way. How much of this is, relative, if you will?
It's a really good question. And so much of this pandemic, the managing of this pandemic is managing the information. And we didn't anticipate that people would be comparing themselves to other jurisdictions and receiving misinformation and disinformation from those jurisdictions. So yeah, I suspect a big part of this is we're not as bad as that guy, so what's the big deal? You have to remember, you have to measure your situation based upon the ability of your population to absorb this crisis. So what is your healthcare capacity? What is your demographic situation? How well are your long-term care facilities protected? What is your age distribution, etc.? So don't look elsewhere, look locally.
Raywat, we've heard at the beginning of the pandemic, our health officials say, listen, we prefer education over enforcement. We want to make sure that if somebody tests positive, that they're not afraid to give us that contact information. So we really don't want to come down too heavy-handed. And now we're seeing them flip the page, if you will, and say, we're going to crack down and we're going to start fining people and really get tough. Has there been any research done which method works better, education or enforcement?
Again, a really good question, and it comes down again to the local culture where we're talking about. So Sweden famously had no lockdown. And one of their rationales was they could rely upon their population to act responsibly if given the right guidance. And I think for the most part, the population did adhere to the public health guidance. Sweden has their issues, of course, but at least they got that part right. The West doesn't seem to have that same benefit. And by the West, I mean North America. So in many ways, we're a bit more reliant upon the heavy hand of government to enact discipline on our behalf, which is unfortunate. But this is the nature of living in a liberal democracy, is that we have to rely upon the democratic institutions and the capacity of individuals to navigate by their own recognizance. And unfortunately, that is failing.
Do you think there will be some interesting research, perhaps with your fellow academic colleagues, on what some of these measures that some have compared to being communist or Nazi-like, if you will, to, weighing that with public risk? I could see you teaming up with some of your perhaps ethics colleagues or others to look further at that.
Oh, absolutely. In fact, this will feed PhD theses for the next 20 years in multiple disciplines, perhaps all disciplines. In fact, I'm exploring a paper right now on what is the ethics of public health. Can we compel human behavior, or is our job simply to provide information and let people be adults and make their own decisions, even if they make decisions that are deleterious for the common good? It's an overall values question that we have never had to interrogate before at societal level. So this is questioning our vision of ourselves as a people and as a society. It's amazing, actually, how pandemics have a way of elucidating the truth of a people, and that's what we're experiencing in real time.
Raywat, when should we expect numbers to go down if these new measures work? We have 241 cases announced today, about half here in Winnipeg, 5 more deaths. How long do we give this?
As always, the magic number is 7 to 14 days. That's how long it takes for people to get infected, develop symptoms, get tested, and get the test results back. So I think people are tired of hearing that 2-week time frame, but that's what it is. 2 weeks to see if the interventions have had any kind of effect.
Raywat Deonandan joining us live on 680 CJOB from the University of Ottawa. Dr. Ruth